Lithium is a mood-stabilizing drug used to treat bipolar disorder. Lithium is also known for having a narrow therapeutic index with multiple side effects. In this mnemonic video, I'll give you an easy way to remember the crucial facts about lithium. It's the big night of the show, but something's gone terribly wrong with our stage mic. Seems like one of our actors has accidentally dropped the lithium battery from the microphone on stage. This lithium battery is our symbol for the drug lithium. You know, since lithium batteries contain lithium. Let's see what else is happening on stage to learn more about lithium. Next, check out that pair of theater masks at the stage manager's belt. Every traditional theater mask set has both a happy and sad face, right? Well, this set of happy and sad masks should remind you of bipolar disorder, since bipolar disorder is characterized by mood swings from intense happiness to sadness. We're talking about bipolar disease, since lithium is mainly used to treat bipolar disorder. While its mechanism is unclear, I like to think that lithium works because of its similarity to sodium. Remember that lithium sits right above sodium in the same column of the periodic table. Since the flow of sodium ions into cells causes depolarization and action potentials in neurons, I like to think that lithium messes with neuronal signaling by competing with sodium. This similarity to sodium is a useful framework to think about lithium in general, as we'll learn later when we talk about lithium's side effects. In any case, lithium has mood-stabilizing properties. That is, it reduces the intense mood swings from mania into depression that are characteristic of bipolar disorder and returns patients to a steady mood baseline. Since our audience is so upset, the rest of the stage crew is hiding behind the closed curtains. Well, we can actually see another stage crew member peeking his head through a narrow gap in between the curtains. Maybe to hand another lithium battery to our poor guy on stage. The narrow gap or window in between the curtains should remind you of the narrow therapeutic window or index seen with lithium use. You see, too low of a dose of lithium means you will not get good treatment of bipolar disorder. On the other hand, too high of a dose will lead to a ton of side effects. A narrow window just means that the sweet spot range of doses, right in the middle, is very, very narrow. This is another way of saying that side effects with lithium are super common. Just remember our backstage crew peeking out of the narrow gap in the curtains to remember that lithium has a narrow therapeutic range. Got that? So we know that lithium can cause side effects. But what are these side effects exactly? Well, let's find out. Did you notice the short, disheveled tie of the store manager? Maybe the guy was late to work or something, because that tie looks really messed up. By the way, this disheveled tie should remind you of hypothyroidism. Get it? Since a tie represents the thyroid or thyroid. A disheveled tie should remind you of thyroid injury causing hypothyroidism. While the mechanism of thyroid-induced thyroid injury is unclear, lithium use is associated with decreased thyroid hormone synthesis and release. Hence, patients taking lithium have to undergo periodic thyroid function tests to monitor for this side effect. Our audience is obviously upset about the show stopping, and to demonstrate their unhappiness, they are throwing packs of jelly beans? Must have been a concession stand snack or something. Anyhow, these jelly beans are shaped like kidneys, which should remind us of lithium-induced kidney injury or nephrotoxicity. Again, the mechanism for lithium-induced kidney injury is unclear, but lithium use is associated with many disorders of the kidney, including interstitial nephritis, diabetes insipidus, and the eventual development of end-stage renal disease. To monitor for kidney damage, creatinine levels are measured periodically in patients taking lithium. Just know that if a patient comes in with elevated creatinine who is recently diagnosed with bipolar disorder, you should be looking out for lithium in their drug list as a potential cause of kidney injury. Amid the chaos and this upset audience, our stage manager is trembling with fear. His unsteady hands played no small part in dropping that lithium battery. By the way, His trembling here should remind you of the tremors and general neuromuscular excitability seen with lithium use. Again, the mechanisms here are under-researched and are therefore super hand-wavy. I like to think that lithium's interfering with sodium signaling messes with action potentials in neurons, causing peripheral nerve excitability. Just picture our trembling stage manager to remember that tremor and ataxia are common adverse effects seen with lithium. Finally, let's look at the true source of our stage manager's fear. Yep, it's that tarantula on the stage microphone. As usual, a tarantula reminds us of teratogenicity. Yep, lithium is teratogenic, meaning that it should not be used in pregnant women. Specifically, lithium is known to cause Ebstein's anomaly, which describes downward displacement of the tricuspid valve, causing atrialization of the right ventricle. You don't need to remember the specific details here. Lithium actually causes a lot of other birth defects. Just picture the tarantula to recall that lithium is broadly teratogenic. All right, that's it for lithium. Let's summarize what we've learned. Lithium is a mood-stabilizing drug used to treat bipolar disorder. It has a narrow therapeutic index with multiple testable side effects. Side effects of lithium include hypothyroidism, neuromuscular excitations like involuntary tremors, and nephrotoxicity. Lithium is also teratogenic and may cause birth defects like Ebstein's anomaly when used in pregnancy. That's all we need to know about lithium. Let's get back to the show. I think they're finally going to get started. I'll see you in the next one.